Assalamu alaikum. This is me, dietitian Mahanur, and in today's video, we are going to talk about the gastritis. We will discuss the pathophysiology, causes, signs and symptoms, and medical management of gastritis. So let's start. Gastritis is an inflammation, irritation, or erosion of the lining of the stomach. It is one of the most common problems affecting the stomach. It can occur suddenly or gradually. Epidemiology. In acute gastritis, the prevalence of eosinophilic gastritis is approximately 6.3 per lakh individuals worldwide. The incidence of the new cases of H. pylori infection each year ranges from 3,000 to 10,000 per lakh individuals in the developing countries. It has been observed that with advancing age, the incidence of H. pylori infection increases. In acute gastritis, females are usually more affected than the men. Etiology. Number 1. Drugs, NSAIDs, corticosteroids. Number 2. Diet, alcoholic drinking binge, large quantity of the spicy, irritating foods and metabolic conditions such as the renal failure can also cause the acute gastritis. Number 3. Microorganisms, H. pylori, Helicobacter infections, Salmonella and Staphylococcus. Number 4. Environmental factors, radiation and smoking. Number 5. Autoimmune gastritis, autoimmune metaplastic atrophic gastritis. Other causes may include burns, large hiatal hernia, physiologic stress, psychologic stress, reflex of the bile and pancreatic secretions, renal failure, sepsis, shock, endoscopic procedures, nasogastric tubes. Let's discuss the pathophysiology. Acute gastritis. Due to any cause, gastric mucosal barrier is penetrated. HCl comes into contact with the mucosa, injury to the small vessels, as a result, edema, hemorrhage, and possible ulcer formation. Let's discuss the pathophysiology of the chronic gastritis. The stomach lining first becomes thickened and edematous and then become thin and atrophic. Continued deterioration and atrophy, loss of function of parietal cells, acid secretion decreases, inability to absorb vitamin B12, development of the pernicious anemia. Clinical manifestation, signs and symptoms, acute gastritis, epigastric discomfort, feeling of fullness, abdominal tenderness, cramping, belching, anorexia, reflex, severe nausea and vomiting, hematemesis. Sometimes GI bleeding is the only manifestation. When contaminated foods is the cause of the gastritis, diarrhea usually develops within 5 hours of the ingestion. Acute gastritis is the self-limiting, lasting for a few hours to days, with complete healing of the mucosa expected. Chronic gastritis. Manifestations are vague and may be absent because the problem does not cause an increase in the HCl. Anorexia, feeling of fullness, dyspepsia, belching, vague epigastric pain, nausea, vomiting, vitamin B12 deficiency, pernicious anemia, intolerance of spicy and fatty foods. Diagnostic evaluation, history collection, drug or alcohol abuse, endoscopy, complete blood count for anemia, tissue biopsy to rule out the gastric carcinoma, urea breath test for Helicobacter pylori infection. Complications may include the bleeding, pernicious anemia, peptic ulcer, erosive stomach lining, mucosal associated lymphoid tissue lymphoma, gastric scarring, and structure with outlet obstruction, dehydration, hemorrhage, gastric perforation, malnutrition, gastric cancer. Medical management. Medical management for acute gastritis. Anti-emetic drugs, perinorm or dopridone, antacid, cimetidine, ranitidine, or famotidine. If ingestion of the NSAID is a problem, prostaglandin E1 analog may be prescribed to protect the stomach mucosa and inhibit the gastric secretion. Chronic gastritis medical management. Discomfort may lessen with a bland diet, small frequent meals, antacids, H2 receptor antagonist, proton pump inhibitors, and avoidance of the food that causes the manifestations. If H. pylori bacteria are present, antibiotics and other medications are administered to eliminate the bacteria. If 1 week of this regime doesn't succeed in eliminating the bacteria, the regimen may repeat it for the additional week. If pernicious anemia develops, intramuscular injections of vitamin B12 may be administered monthly for the remainder of the client's life. So this was all for today. Thanks for watching the video. Hope you liked the video.